It is probably fair to say, when you hear the words quantitative and qualitative research, do your eyes glaze over? It's okay, you're not alone. But here's the thing, understanding the difference between these research types is crucial if you want to fully grasp research and evidence-based practice as a nurse. So, let's make this simple. By the end of this video, you'll confidently be able to identify primary quantitative and qualitative research in studies, understand the key differences between them, know when to use each type in nursing practice. This knowledge will help you make informed clinical decisions and advocate for your patients with confidence. What is primary research? Let's start with primary research. This is when researchers collect and analyze new data themselves. It's first-hand research. Primary research is also known as original research, typically reported as a single study, meaning only one study, explained in detail by the researchers themselves. Since primary research will be about one study, you should know that any study that is a review or analysis of multiple studies is not primary research. Therefore, a systematic review, meta-analysis, literature review, scoping review, or integrative review are not primary research. But how do you tell them apart? Let's break it down. Primary quantitative research. This type of research collects numeric data to measure variables, test hypotheses, and find patterns. The focus is on objective results. Think numbers, percentages, and statistics. Here is an example scenario. Imagine you're a nurse on a cardiac unit and you're curious about whether patients who use a heart health app have better medication adherence than those who don't. So you conduct a study on 200 patients, track their app usage, and analyze how many take their meds correctly. Why is this quantitative? It involves numbers, the medication adherence rates. It uses statistical analysis to find a pattern. It tests a hypothesis. Does the app improve adherence? Other examples of quantitative research in nursing include a clinical trial testing a new blood pressure medication, a survey measuring nurse burnout on a scale from 1 to 10, an observational study tracking infection rates in post-op patients. So how do you identify quantitative research in a published study? Look for words like measured, statistical analysis, percentage, or p-value. If the results are mostly tables, charts, or graphs, it's quantitative. Other clues to look for include the title and abstract, which clearly state that it was a randomized controlled trial, a common quantitative research design. Also, at the top of the article states it was original research, which is primary research. Lastly, this is a single study reported by the researchers who completed the study, so it is primary research. Primary qualitative research. Instead of numbers, qualitative research focuses on words, experiences, and meanings. The goal is to explore how and why people feel or behave a certain way. Here is an example scenario. Let's say you're working in palliative care and you want to understand how patients with terminal illnesses experience dignity during their final months. So you conduct in-depth interviews with 15 patients and analyze their responses to identify themes. Why is this qualitative? It collects words, not numbers, patients' personal experiences. It explores perceptions and emotions, not measurable data. It finds themes rather than statistics. Some qualitative research examples in nursing include focus groups with nurses about their experiences with patient safety policies, a case study exploring how new nurses adjust to night shifts, observing interactions between nurses and patients in a dementia unit. So, how do you identify qualitative research in a published study? Look for words like interview, themes, perceptions, or lived experiences. If results include quotes from participants or thematic analysis, it's qualitative. Other clues to look for include the title and abstract clearly stating it was a qualitative study. Also, the top of the article states it was a research article. This is a single study reported by the researchers who completed the study, so it is primary research. Still confused? Here's an easy trick. If you see numbers, surveys, statistics, and charts, it is quantitative. If you see interviews, themes, and personal experiences, it is qualitative. When should you use each type of research in nursing? Use quantitative research when you want to. Measure outcomes such as infection rates, pain levels, retention rates, or level of satisfaction. Test new treatments, theories, or interventions, or to compare groups using statistical analysis. Use qualitative research when you want to. Understand patient or nurse experiences. Explore emotions, beliefs, or cultural influences, or to develop new theories. As a quick recap, primary quantitative research equals numbers, measurements, and statistics. Primary qualitative research equals words, experiences, and themes. Now that you have a good understanding of identifying quantitative and qualitative research, let's check your knowledge. Question 1. A study surveys 500 nurses and analyzes the percentage who report job satisfaction. What type of research is this? The correct answer is quantitative because it uses numbers and wanted to know what percentage. Question 2. A study interviews 20 nurses about how they emotionally cope with patient loss. What type of research is this? The correct answer is qualitative because it explores personal experiences and feelings. A study tracking post-op infection rates from 375 patients has plenty of data and charts from statistical analysis. Is this quantitative or qualitative? It is quantitative because it measures infection rates as an outcome, uses statistical analysis and numerical data to present its findings, and has a larger sample size. Question: study exploring 25 nurses' feelings about shift work using interviews. Is this quantitative or qualitative? It is qualitative because it explores feelings and experiences, collects data through interviews, and has a smaller sample size. Thanks for watching. If you found this video helpful, subscribe to the channel for more nursing education content.